Thank you for joining us for this Advent Health virtual seminar.
Today we're talking about shoulder arthroplasty, or an artificial shoulder, or replacing your shoulder. So I think the thing that you have to understand is that our anatomy is really interesting in that we have cartilage and bone, and we have a ball and socket joint in our shoulder that allows a tremendous amount of motion. The shoulder joint is the most versatile mobile joint in the entire body. And when we have problems with that joint, it can lead to significant limitations in motion. So any joint has both bone and cartilage. And the cartilage is kind of like the cushion or the compression that allows your joint to be a little more springy. And as that cartilage degrades, it can result in that smooth gliding surface changing. And when that happens, when that cartilage breaks down, instead of this nice smooth gliding surface, you get a pitted grinding surface that can lead to popping, catching, and terrible pain. As that occurs, the body tries to adapt by making a larger surface area of bone, which results in bone spurs and other changes on the x-rays. But what happens to you as a patient? It becomes painful. You have pain with activity. You can no longer play golf or tennis. Perhaps swimming is difficult. It interferes with sleep, and you wake up at night and your shoulder is aching and you're wondering what's going wrong. There's swelling, and oftentimes it's even tender. As you touch your shoulder, it hurts to touch. How can we treat this? Well, I think everybody is pretty familiar with over-the-counter medications. There's probably not a week that goes by that I don't make a trip to the pharmacy for something. So we are all familiar with anti-inflammatories such as Aleve or Motrin, and as a first-line treatment, these are reasonable. You can modify your activities. You can change your activities. So if you're doing high-demand sports, maybe you go to lower demand or low-impact type activities. Physical therapy can be helpful, and it's often really amazing if you get a great therapist to work with you to teach you how to better use your muscles and your body to do activities. Finally, we can do injections, and you can come to your primary care or orthopedic doctor and have what my mom would call a cortisone shot or an injection in the shoulder that will tend to decrease the inflammation. So when do you think about surgery, or when does that become an issue or something that you might want to do? Well, I think you don't want to take this lightly, and I think you want to wait till you've reached a point where you no longer get relief with over-the-counter medications, you can no longer do your hobbies, and maybe you're not even getting a restful night's sleep. So my ability to shave, to groom, to wash my hair is important to me, sleeping through the night so that I am in a good mood in the morning, and finally my ability to go to work and do my job. When you can no longer do these things, you should consider replacing the joint. So how do we do it? Well, interestingly enough, when we do surgery, we're really never cutting through a lot of muscle. We go between muscles. So for the shoulder, you have your large deltoid and your large pectoralis major, and you make an incision between the two. Actually, if you do that and you watch a surgery, you'll see that you're really getting very little bleeding. There's a vein that runs in that groove, but you're not cutting through the muscle. Once you've developed that plane and opened up the shoulder to get inside, you're looking at the deep structures, which are your rotator cuff and your long head of your biceps. When I look at that, I see this big muscle in the front called the subscapularis. It's one of 4 rotator cuff muscles. Historically, to gain access to the joint, we created a trap door. We released the muscle, allowing us to dislocate the shoulder and to do our surgery. But if we do cut the muscle, it is a 3-month healing process until there's complete healing of that muscle after surgery. So maybe we can avoid this. So another option is that we have now developed a technique where we can work through windows above the muscle and below the muscle. So we create a window in the rotator interval, and we create another window below. And by working on either side of the tendon, we can preserve its attachment, thereby making it possible to return to activities quicker. Now, we don't always do that. There may be cases we can't, but if you are a candidate, it will certainly shorten your postoperative immobilization and expedite your recovery. Once we have gotten access to the joint, we then use precision instruments. We have developed guides that are cutting blocks or jigs, and for individuals who like woodworking, these allow us to use end cutting saws to remove the humeral head and to plane through that interval. The guide is a stainless steel guide that allows us to make these precision cuts. Once that's done, we prepare the medullary space, and quite frankly, there's very little going on in the medullary space as we get older. It's not making blood. Most of it is fatty marrow. You ream it out, you broach it, and you put your component in the humerus side, and there will be a ball that will go on that. And on the socket side, we gain access. We're going to grout in, and it's really a bone cement that we grout in a plastic socket that allows for this cobalt chrome ball to mate up with this plastic socket, thereby eliminating any friction or irregular surfaces. You have a smooth gliding surface. Now, what about that tendon? If the subscapularis tendon is detached, you got to sew it back. The problem there is that if we do that, now it takes 3 months for the tendon to heal. And so we have to really be careful, immobilize for 6 weeks, so you're really handicapped with one arm during that period of time. But if we can keep it intact, which we've been doing now at Advent Health Carrollwood, the shoulder is only immobilized for 1 to 2 weeks. Significant improvement in quality of life. You can drive sooner. You can go out to dinner if you would like to. You can go for a walk without your immobilizer. You have your freedom of your arm back for your hygiene. The finished product is a titanium stem, cobalt chrome ball, and a high molecular weight plastic socket, which is made in the great state of Ohio. So I think that kind of sums it up. And then after surgery, what we like to do is to use a shoulder mobilizer sling for 1 to 2 weeks, some gentle home exercises, and then at 6 weeks, we go a deep dive and begin formal therapy with a therapist to regain flexibility. And finally, at 3 months, we go for strengthening. And by 4 months, you should be able to do most activities. We have follow-up appointments. We love to see you back to make sure you're progressing appropriately. The operation itself is 90 to 95% successful. So there are some cases where it does not work. And that's why you need to make sure you are at that point where there are no other options before you elect for surgery. But 90 to 95% of people have better function, less pain, and get back to the quality of life that they expect. So you can do almost any activities you want. My only restrictions, which I've found over the years, is that if you do not know how to play golf, if you do not know how to ice skate, downhill ski, or shoot, you should not learn after you get your shoulder replaced. So those jolting sports, if you're hitting the ground with a golf club or you're falling on the ice because you don't know how to do it, should be left to other individuals. And finally, I don't think you should play football, gymnastics, hockey, or rock climbing if you have an artificial shoulder. It's been a real pleasure to talk to everybody today. I think that if you had to take anything away, remember there is no perfect operation. There can be complications that you need to be aware of. So never take it lightly, but we now can offer you an option to restore your level of function that you would like as you get into the point of life where you like to enjoy yourself. Thank you very much.